Welcome to Truthcast TV. Today I want to go over a few numbers and let's just see if it's as bad as they told us that it would be. Well, right here we have 1.5 million confirmed cases in the United States, okay? With only 91,582 deaths. Now, they told us a little over 2 months ago that there would be 200,000 to 300,000 deaths in California alone in the next couple of months with this coronavirus, with this pandemic that we all of a sudden found ourselves in. California, as of today, reports 78,000 confirmed cases with only 3,261 deaths. Wow, that is significantly lower than the number that they told us it would be. And this overall is significantly lower than they told us it would be. Significantly lower than what they told us that it was going to be. Imagine that, right? So we took the greatest economy in the history of the world and we decimated it. We took thousands, hundreds of thousands of small businesses' livelihoods right out from underneath of them, all for this. And let me reiterate the fact that this number is highly inflated. There have been numerous amounts of doctors, numerous amounts of scientists, numerous amounts of morgue personnel that have come out and said that they were told to manipulate the death certificate or the data in some sort of fashion. So it would look like more people were dying from COVID-19 than there really are. So this number really probably should only be about 10 to 20,000, if that. But it's at 91,582 because they inflated that number by about 70 to 80,000. Now that's not a fact that I know. But from all of the research I have done from the doctors that have come out and said that they wanted them to manipulate the data on COVID-19 patients, basically anybody that died within the past 2 months, whether they had the virus in their system or not, it was put down they died of COVID-19. And like I said, we know that because several doctors have come out, several morticians have come out and said that they wanted them to manipulate the death certificate or the data to make it look like they died of COVID-19 when they really did not. So, confirmed cases 1.5 million, 91,000 deaths. You take 40 plus million Americans, put them out of jobs. Now they're living off of unemployment, which they probably, I guarantee, haven't even received yet, and maybe another month or two before they do. Then you decimate all of these hundreds of thousands of small businesses. You take their livelihoods. All within a matter of days. You take their livelihood. Everything they've worked for their whole lives, you take from them. And then arrest some that just want to feed their families and their employees' families. And you arrest them because they open their business up trying to make a living so they don't have to close down. And you arrest them. Like the salon owner in Texas that spent 7 days in jail or was sentenced to 7 days in jail just because she wanted to feed her family and her employees' family. You don't get no more tyrannical or Orwellian than that. This is the home of the brave, but it damn sure right now isn't the land of the free, nor has it ever been. I want to go on to this right here. Multiple states sharing info on coronavirus patients with law enforcement. Now, why would they need to do that? And whatever happened to patient confidentiality? We remember what that is, right? That confidentiality is the right of any individual to have personal, identifiable medical information kept private. Such information should be available only to a physician of record and other health care and insurance personnel as necessary. As of 2003, patient confidentiality was protected by federal statute, or supposed to be, right? And the purpose of it is the passage of federal regulations. The Health Insurance Portability and Accountability Act of 1996 was prompted by the need to ensure privacy and protection of personnel records and data in an environment of electronic medical records and third-party insurance payers. And the description was, patient confidentiality means that personnel medical information given to healthcare provider will not be disclosed to others unless the individual has been given specific permission for such release. Because the disclosure of personal information could cause professional or personal problems, patients rely on physicians to keep their medical information private. It is rare for medical records to remain completely sealed. However, the most benign breach of confidentiality takes place when clinics share medical information as case studies. When this data is published in professional journals, the identity of the patient is never divulged, and all identifying data is either eliminated or changed. If this confidentiality is breached in any way, patients may have the right to sue. Now, that's what it says under the patient confidentiality law that was passed in 2003. Now, we're reading multiple states sharing info on coronavirus patients with law enforcement. Why would they need to do that? Unless there was a plan that they have in place where they're going to need all of this information a little further down the road. Let's read a little bit. Officials in at least 10 states are actively sharing names of residents who have contracted the coronavirus with law enforcement, potentially dissuading people from reporting cases of the disease, according to a Tuesday report from the Associated Press. A study by AP found that officials in at least two-thirds of all 50 states are sharing addresses of infected individuals with members of law enforcement in at least 10 states. The information also includes the name of the individual. Here are the states: Tennessee, Colorado, Nevada, New Hampshire, Ohio, Louisiana, Ohio. Excuse me, let me start over. I can't read today. Tennessee, Colorado, Nevada, New Hampshire, Iowa, Louisiana, Ohio, North Dakota, New Jersey, and South Dakota all share names of individuals with confirmed cases of COVID-19 with police, according to the AP. Wisconsin previously did as well, but has since stopped. Why would they need to share your information with the law enforcement? Think about that for a second. Privacy advocates and civil rights activists have noted that many communities, particularly those of color, have historically fraught relationships with law enforcement and thus may be dissuaded from reporting the disease to the health officials as a result. Experts have already noted that the pandemic has hit minority communities at greater levels. The information could actually have a chilling effect that keeps those already distrustful of the government from taking the COVID-19 test and possibly accelerate the spread of the disease, the Tennessee Black Caucus told the AP. Tell us how it's working for you, then tell us how well it's been working. Don't just tell us you need it for your job, added State Representative G.A. Hardway. Who chairs the caucus? One lobbyist with American Civil Liberties Union questioned why the information sharing was necessary when many police officers are being told to expect that anyone that may have come in contact with could have the disease due to the rate of asymptomatic carriers. Asymptomatic carriers. I'm sorry, y'all, I can't read today. If that is the best of the recommended practice, then why the need or desire to share specific information with the first responders? Gary Daniels asked. So why would they need to tell the law enforcement officers your information? Well, I'm sure I'm sure they've got it all planned out. I'm sure there's something in the future that they'll need all of that information for. Let's go to this story right here since we're on that subject. Elderly home turns to wearables for contact tracing, sidestepping Apple Google limits. When a senior living facility in Amarillo, Texas suspected a nurse may have caught the novel coronavirus this month, it had a list within 5 minutes of staff and residents the nurse could have infected. High-tech wristbands worn by the Legacy at Town Square, 35 workers and 49 residents expedited contact tracing, the otherwise painstaking process of interviewing patients to determine who crossed paths with them. The nurse tested negative an hour later, and Legacy did not have to isolate or test others. But its experience shows how wristbands and other wearables have emerged as the tools to automatically record encounters between people at places that can mandate their use. Facilities with quick contact tracing following infections in the coming months will be better positioned to ward off outbreaks and stay open, according to epidemiologists. So that could be why. That could be one of the many reasons they need all of that information. But yes, this is the world we live in 2020 in America. It is as Orwellian and it is as tyrannical as it has ever been. And it's only going to get worse until millions of Americans rise up and say enough is enough. We're going to open our small businesses back up. We're going to go back to work. We're not wearing masks everywhere we go. We're not taking your damn vaccination. I know I'm not. I'm going to do my part, and I'm going to keep it 100. I'm going to keep it as real as it gets. I'm not wearing a mask in no damn where. I'm not going to take no vaccination to go back to work or anywhere else for that matter. So I don't just preach it, I live it. And they'll have to throw me in a fucking FEMA camp or in prison, or they can do whatever the hell else they want with me. I don't give a shit. I will not take your test. I will not take your vaccinations. And I will not follow by these Orwellian, tyrannical, bullshit rules and laws that y'all have put into place ever since this pandemic has come about. And I suggest everybody do the same. If you're new to this channel, click that subscribe button for me. If you like this video, click that like button. It'll help me out a lot, and I'll greatly appreciate it. And I just want to say thank you to my subscribers. Thank you for supporting me. If it wasn't for y'all, there would be no reason to do any of this. And if I can just wake one person up, then it's better than sitting on my ass not trying to do nothing. Hope everybody has a damn good day. I got plenty more content coming this week, so stay tuned. And remember, stay woke. And until next time, I'm out.